folks, Dr. Ed Byer. Today I'm going to be talking about a question that I get a lot from my patients. Either they know they have Hashimoto's when they come to see me, but I'll tell you, probably 75% of them don't know it. And this is the number one cause of low functioning thyroid, the autoimmune disease known as Hashimoto's. Um, why doesn't my doctor check for this, Dr. Byer? Well, that's a good question that I get. And people are they're surprised. I had two patients this week when we did their blood work that I diagnosed them because they were forming antibodies to their thyroid and they didn't know it. And one of them was actually male, which is kind of unusual. But the reason why is because traditional medical doctors, they are trained to only manage one component of low thyroid, and that is to look at the TSH, thyroid stimulating hormone, which comes from the brain, the pituitary gland, and how much T4 it's stimulating to make. That is what they look at. I'm just going to save you a lot of time and aggravation if you think they look at anything else. I've been doing this for 30 years. I've never seen it. They may run the antibodies and they may check for Hashimoto's on rare occasions. Most of the time they don't. Even if they know, even if they see it, they still are not trained to do anything for it. So that's why most doctors don't check for antibodies against the thyroid or Hashimoto's disease, because they don't have an answer for it. And if they don't have an answer, why would they seek for it? Okay? So they're trained in this one component. So Hashimoto's is an immunological problem. The thyroid gland is just being an innocent bystander, and the immune system's attacking it. In my long video, I get into the 15 top causes or triggers to that, and that's something that they don't look for. Remember, traditional medicine, they want to diagnose you and then put you on some sort of pharmaceutical, whereas with functional medicine, we want to know, why do you have these things? And that certainly is extremely true when it comes to autoimmune disease. There's no medication for it, so they're not going to look for it. And traditional medicine is a pharmaceutically driven system. So if there's no they're not going to seek for things that there isn't a medication for. And that's really the long and short of it. I know it sounds very simple, but it's true. Always remember too, folks, that there are, in the scientific literature, there's 22 ways the thyroid can underperform, and 2 of them are an autoimmune variant. Okay, so all my Hashimoto's patients also usually have, I should say, some of those other 20 ways that need to be investigated. I'm Dr. Ed Byer. I hope that helps. Have a great day.